Hi, welcome to an overview of Violet's cancer treatment plan. This is a short video to help give our friends and family some of an idea of the treatment phases that Violet will be going through. It's also a way for me to help analyse and organise a lot of the information that the doctors have given us over the last couple of months. There's a lot to Violet's treatment plan, and we can only see as far as the road goes. In the early days, we were only sort of looking, a couple of days ahead. I like this picture because it's like we know the destination is over there on the horizon where we see Violet's, going to be healed from cancer and it'll be gone from her body. But at this point in time, we can only see, a couple of weeks or a month ahead of us. So we can only see up until a bend in that road. A saying that I've had right from day one is the only constant is change. Just to make sure that I've got that in my mind through these slides, I'm just going to put the symbol for change delta in the bottom right hand corner of the slides. Dealing with change is difficult for everyone, but something that gives Colleen and I comfort is Matthew 6:34. Not worrying about tomorrow because it'll worry for itself. Today's got enough worry for itself. So let me tell you a little bit about Mr. Weed. That's the name that Violet's given to her tumour. It's a neuroblastoma near her left kidney adrenal gland. It's slightly larger than a cricket ball, and it had metastasized to other parts of her body, so she had little bits and pieces all over her bones. The oncologists have told us that there's 3 ways that every cancer is treated. It's just a different way, I suppose, for each different type of cancer. So they shrink it through chemotherapy, cut it through surgery, and fry it with radiotherapy. There's 3 phases to the treatment plan: induction, consolidation, and maintenance. But I like to add another one, which is the diagnosis phase, up the front there. We're currently in induction phase, and I'll go into that a little bit shortly. Starting with diagnosis, we started to really see things in Violet back in September last year, where she had a bit of a tummy bug and never really got better. In October, we saw that she had a low-grade fever that never really improved. Late October, we got the referral from our GP to go to the hospital, and then, was at Prince Charles and then Lady Salento for 10 or so more days of scans, blood tests, ultrasound, CT scans, bone scans, MIBG scans. The induction phase has 3 components to it: 6 3-week chemo cycles, a stem cell harvest, and surgery. But if we play that out, the way that it really looks is like this. In cycle 2 is where the stem cell harvest goes, and then in cycle 5 is where the surgery is. Then again, it may be in cycle 6, based on a whole number of things. So no cycle is the same, hence bring back the symbol for change. The best analogy I've got is cocktails. So you may put tequila in a slammer, or you may have it in a Long Island iced tea. So one, you slam down fast, lipstick suck, and the other, spend time, taking your time drinking it. It's the similar with the chemo drugs. You could have the same chemo drug in 2 cycles. One is given fast and the other one slow. And as we'll see in the next slide, that's pretty clear. So this is the way that the cycles fall. Cycle 1 and 2 were the same. It was 5 days, 2 drugs, 60 minutes a day, with cycle 2 having the stem cell harvest in it. Cycle 3 and 5 are the same, with cycle 5 having surgery in it, but it was, chemo delivered over 4 days, 2 drugs, 60 minutes a day. The other, 23 hours in a day was keeping, the IV fluids up. And cycle 4 and 6 is 3 days, 4 drugs, and one of those drugs is actually administered over the full 72 hours. Another drug is actually pushed over a 5-minute period. The way that a cycle actually looks is broken down like this. So, in week 1 we start with chemo. There's a whole heap of things that happen on day 1 as to whether or not the green light's made and the chemos are actually manufactured at Lady Salento and then brought up into the ward to be administered. So week 1 is chemo. Then each week we end up having these clinics, which is where the doctor looks at bloods. We do dressing changes and things like that. So after chemo is finished, 24 hours after is when GCSF is given, which is a growth stimulating thing to help the bone marrow produce more white blood cells. And the reason for that is usually after chemo, there's a huge drop in the white blood count. And this helps sort of boost that count up and help reduce the infection. Usually a little later in the cycle, depending on what the drug is when the hemoglobin and the platelet counts drop as well. So we may end up with like another clinic visit in week 2 as well for the doctor to sort of see whether whether Violet requires a transfusion. I've added sleep deprivation because whenever we're in hospital, it's really hard to, keep awake during the night. Well, keep asleep during the night with, observations and all drugs and whatever given during the night. And then even after we come home, we're sort of then giving anti-nausea drugs and whatever as well. In the last cycle, we ended up having a couple of days at home, and then during week 2, we were back at hospital again. So there's only been a couple of days right at the very end of the cycle that we actually feel human again. So that's the way that a typical cycle in the induction phase goes. So the consolidation phase has 2 components, a heavy dose chemo and radiotherapy. This is where the road gets a little bit hazy for us because we haven't reached this phase yet to ask a heap of questions. We're still sort of focused on the induction phase and what's going to happen in surgery in the last 2 cycles there. With heavy dose chemo, we do know that it's going to be 3 to 4 weeks in hospital, a much heavier dose of chemo. They wait until the white blood count really drops down, and this is where the stem cells that were harvested back in cycle 2 in induction are transplanted back in, and then they watch to see the white blood cell count recover, and by that stage we should be home again. So we'll praying that all goes well. Maintenance phase seems to be a little more simple. It looks like it's a phase that has 6 cycles to it, 28-day cycles. Quite possibly maintenance phase will be at home, and hopefully will be straightforward. So just in closing, I sort of bring back my friend Delta because what I'm about to show you with the dates, it could very well change, as well as me adding in a monitoring phase. So across here, we sort of see diagnosis was in November. We're now, in early February, which is going into cycle 5. Surgery might be late February, so we might be finished induction phase in late March. The heavy dose chemo might end, late April. Radiotherapy for a couple of months, so consolidation might finish June, and then 6 months of maintenance. And then 5 or so years of monitoring, so different scans and whatever to see whether things are progressing or like staying, or no cancer is returning, which is clearly what we're hoping for. Thanks for your time. I hope this has been informative and has cleared up some questions that people have had. Thanks.